Welcome to our video for flexible sigmoidoscopy. We understand that undergoing medical procedures can be worrisome, but we are here to guide you through the preparation and process to ensure your comfort and safety every step of the way. This will give you enough information to allow you to make an informed and proper decision for your particular situation. Hello, I am Dr. Maharaj, and I will be guiding you through the consent process for your upcoming flexible sigmoidoscopy. A flexible sigmoidoscopy is a procedure used to examine the inside of the last part or left side of your colon, also known as the large or thick intestine, using a flexible sigmoidoscope or a colonoscope. The last meter or so of the colon, rectum, and anus are examined for any abnormalities. We can help assess the extent and even treat many of these anal and rectal diseases without needing a very intense bowel preparation. We can often do this examination without you going to sleep, but prefer you to sleep for about 5 to 10 minutes while I examine you comfortably and perhaps treat you too. If we find any abnormalities like polyps, masses, or inflammation, we can remove them or take samples during the procedure and send them for examination by a pathologist later. The results will be available in about a few weeks. If there is something concerning, we will contact you. A copy of the results will be forwarded to your family doctor. Next time you see your doctor, confirm that the polyps or samples, if any, are of no immediate concern. Following your flexible sigmoidoscopy, you may experience some bloating, gas, or mild cramping as the air used during the procedure passes through your digestive system. These symptoms usually resolve within a few hours to a few days. As much as possible, you may return to eating normally. There are several reasons why your doctor and I may recommend a flexible sigmoidoscopy and a left colon examination, evaluation of anorectal diseases. This is the most common reason for me and my staff to recommend this procedure. You may have bleeding after passing stool, anal swelling, or prolapse with something, usually hemorrhoids, coming out. Also, pain, mucus leakage, or itchiness are also possibilities. These symptoms can be due to anorectal diseases such as hemorrhoids, fissures, which is like a tear, an ulcer, or a fistula. A fistula starts as an abscess containing pus inside the anus and forms a tunnel between the inside of the anus and rectum to the outside buttocks. All these can be seen with a camera that magnifies this very tight area with excellent lighting. Looking for things like polyps, inflammatory bowel disease like colitis, or cancer in the lower part of your colon above the anus comes next as we go a little deeper inside. These things can cause many of the symptoms we mentioned before. Not all bleeding is from hemorrhoids. Adequate bowel preparation is essential because it allows us to thoroughly examine the lining of your colon for any abnormalities such as inflammation, polyps, tumors, hemorrhoids, fistulas, and anal fissures. A well-prepared colon provides clear visibility, and if there is a surgical procedure, especially in the anorectal region, the risk of infectious complications decreases. It is important to finish the bowel preparation as instructed to reduce the risk of infection. If the cleanout preparation is considered inadequate, I may recommend scheduling another flexible sigmoidoscopy later to ensure a thorough examination of the lower part of your colon and anorectal region. This may also be a reason for us not to go ahead with any planned anorectal surgery as infections are more common. If you have agreed to have look inside and are scheduled for a flexible sigmoidoscopy, here is what you need to do for bowel preparation. Your last meal before the procedure should be consumed no later than about 2 p.m. on the day before your flexible sigmoidoscopy. At about 6 p.m., take 1 packet of the clean-out medication, mix it in a cup of water, then drink at least 2 liters of clear fluids at once. A gentle clean out of the colon will occur about 4 hours later. 2, 4 hours before you come to the clinic, give yourself a saline or phosphosoda enema to wash out the remaining waste from your rectum, ensuring thorough cleansing. Refill the enema bottle with warm water and do the enema again once or twice. Empty your rectum afterwards. You can insert a medicated suppository if your hemorrhoids are irritated. On the day of the procedure, you'll have the option to undergo the flexible sigmoidoscopy with or without sedation, but we generally recommend sedation. Sedation enhances your comfort, relaxes both your body and your colon, and allows for better visualization of your colon. You will need to arrange for someone to drive you home and stay with you for a few hours after the procedure, as you are advised to not drive, travel on your own, operate machinery, or make any important decisions for the rest of the day. I want to help you to a better quality of life. Despite my best efforts to not hurt you, I may cause a complication to occur. While a flexible sigmoidoscopy is a safe procedure, it is essential to be aware of the potential complications and risks, or the likelihood of the complications occurring, as well the alternatives. Complications include pain. Putting a thin, flexible scope into the anus and through the rectum into the left colon can be uncomfortable with occasional twinges of pain. Doing the initial procedure awake so you can see, then a more thorough assessment while you're asleep for about 10 minutes can make it less unpleasant. Bleeding can happen when we take biopsies, remove polyps, and when we do any anorectal procedures. If you bleed heavily, pass clots, or if blood drips without stopping from the anus, you should seek medical help in the emergency department of your nearest hospital. During the insertion of the camera internally, or the removal of polyps, or doing any kind of biopsy or surgery procedure, we can cause a perforation or make a hole in the bowel by accident. We try to prevent this as much as possible. If it does happen, you may need further care in hospital as you may become extremely sick without it. Very rarely, some patients may experience adverse reactions to the sedative medications used during the procedure, such as difficulty breathing or allergic reactions. Although rare, there are potential risks associated with anesthesia or sedation, such as allergic reactions, difficulty breathing, or heart issues. It is important that you do not eat anything for at least 12 hours before the procedure to reduce the risk of anesthetic complications, especially breathing problems. Intravenous site complications at your hand or arm can also occur, which may include swelling, inflammation, bruising around the vein, and infection. If you experience severe pain or unusual symptoms after the procedure, please contact us immediately or seek emergency care. Although exceedingly rare, there is a small increased risk of infection following a flexible sigmoidoscopy, particularly if we perform a surgical procedure, like putting a rubber band around a hemorrhoid to attempt to shrink it, or if you chose to have hemorrhoid removed by cutting it out. It is important to finish the bowel preparation as instructed to reduce the risk of infection. This also prevents us from missing some lesions of importance like fissures, growths, polyps, or cancer. Alternatively, you can come in without any preparation or sedation for a quick examination. You and I can directly see what is troubling you while you are awake. Sometimes I can also treat you without looking inside and base the diagnosis and treatment from your symptoms, history, and physical examination. Though without proper visualization, I may not have a good understanding of your problem, and thus treatment may not be possible or may be inadequate or delayed as different problems come with different solutions. For example, fissures are treated very differently than hemorrhoids, polyps, colitis, or cancer, the latter two being quite rare. It is essential that you understand the nature, benefits, and potential risks of the procedure, as well as any alternatives. If during the procedure we discover an abnormality that requires additional treatment, I may recommend further action in real time to ensure your best care. Please leave your valuables with a family member before the procedure, as we are a procedure-based practice and do our best in caring for all of our patients, ensuring everyone understands each procedure, has the opportunity to ask questions, and taking great care in performing each procedure. You may not be seen exactly at your scheduled time and may even be waiting for a few hours. We ask for your understanding and patience. When it is your turn, we will also do our best to give you high-quality care. Thus, please do not make plans for at least 6 hours after your procedure. You would likely be spending at least 2-3 hours in our clinic. Thank you for taking the time to watch this video to learn about your upcoming flexible sigmoidoscopy. If you have any further questions or concerns, please do not hesitate to ask us. We are here to support you every step of the way. I will be behind you 100%. You will be asked for a code to verify that you have watched this video and understand its contents. Please write the code above, FS924, in your consent form. Thank you.